don't get, because you can make money doing the right thing. You can
Exactly.
make money
Sure you can.
practicing appropriately. So using again ER as an example, when we provide good care and the employees are happy, the staff is happy, the nurses are happy, the doctors happy, patients come in, they feel they're well taken care of, they come back. Well, when they come back, they bring their money with them. Now, I don't like people rebounding back in the ER, but they use the system that ER is a part of also because their experiences have been so great. Now, you can force them into it like they do with insurance companies that say you can only go to this in network or that's in network. That's a way to lock them in and not care.
That's my point. That is where the money gets dirty. And
that's right.
And that's where I think it became so difficult for physicians. And we came to a point where we could no longer just do the job and bill the insurance company and we were going to get paid. There got to be many more layers. We started with the HMOs and the TBAs and the alphabet soup of payment systems that we have. And at the top of that chain, there are a lot of investors that don't give one rat's ass about your emergency room and how much pressure you're under.
Till they're the patient.
And so the money is so far from you that it just, the connection is not where it should be anymore. And so I think that what we're talking about here, whether we realize it or not, is that we're going to have to give some serious thought to how we pay for healthcare in America. Absolutely. And I'm going to tell you something else that just really blew me out of the water. My first job was in a multi-specialty group in Clearwater, Florida. When I started practice, it was pretty much traditional medicine back then. And then came along the idea of HMOs. And because we had so many partners and we were able to service so many customers, like school boards and police departments and all that kind of stuff, we were able to do our own HMO. And we started the thing. And it wasn't long before we were so successful that an insurance company wanted to buy it. And we thought, man, that's great. Put all this money in our pocket. It's going to be good.
Right.
And so that happened and things went well and we bought it back and we sold it to somebody else. Fortunately, I left before it got really dirty. But the continued rerouting of the money gets to be very dirty. And I remember having a serious conversation with my very close friend who was also a physician who ultimately became the CEO of our corporation. And we were talking about the difficulties of how are we going to go about continuing to get the doctors paid, get the patients taken care of, and get the investors paid. And these questions started to loom in my mind. Now this guy is a fire-breathing, private enterprise, Republican kind of guy. And he looked me straight in the eye and he said, I'll tell you how we're going to do it. Medicare for all. Everybody's going to be on one payment plan. And I didn't know what to say.
I don't, I don't know about Medicare for, like, I'm not too much into that argument. I just know that we need socialized healthcare. I believed in it since I was 18.
I think that's where it's got to be. Yeah.
You got to take the profit out of medicine or the patients will never be number one. That's never going to happen again.
Yeah.
Well, that's what this situation has demonstrated very, very clearly. For those who are becoming, if you will, woke to the situation, you can't help but see it. I mean, Medicare, it's there when you've got, record profits that are happening for insurance companies, yet we can't buy medications that are basic, for those of us who are, the consumers. There's the
Medicare
picture,
for all
guys.
Medicare for all is not a good name for it because the politicians have made Medicare such a disaster.
Right. I agree.
But
the difference will also be there, though, that as you bring out the folks that are coming out now who come out with these debts and they can't make the remuneration to pay off these debts, then why not get an MBA, or why not get a JD, MBA? Why go into medicine? So I don't think you're going to get, that's down the road. And I'm not using that as a change. I agree the payments have to change and how we do it, but it's going to change the clientele that are taking care of you down the road. And I suspect a lot of those physicians will come from outside our borders as time goes forward. I don't know that. I mean, I'm just throwing that out. Now, you remember, Randy, we had that one fellow who was on your podcast, or was he in this, that talked to us about Medicare for all. And then he actually had a good bit of logic. The man from Iowa.
Yeah. Started in Iowa. I think that was Ed Weisbart, if I'm not mistaken.
But
that's exactly right.
Natalie, his argument, it was interesting. You'd have fun going back and listening, because we all sat there and we're going, yeah, okay, right, sure. And then we listened to his argument and you go, oh, well, okay. That he had a lot of good points.
There is some wisdom in that. And and by the way, that comment from my colleague way back then, we're talking like 30 years ago. This was before anybody ever heard of Bernie Sanders.
Yeah.
We put everybody on Medicare. And the point is that if it's going to be this expensive, we have to make it so that it really is accessible to everybody. And of course, the UK does that. And nobody is deliriously happy about it, but yet they don't show any interest in trying to do it differently.
Well, they also have a bifurcated system.
They do. So. But the Democratic Republic of Germany does not.
Right.
There is a population that's deliriously happy with their health care.